This is the oral glucose administration skill. We use oral glucose to elevate a patient's blood sugar when they're diabetic and it's below 60 milligrams per deciliter. To begin this skill, we're going to have standard precautions in place. We've already assessed our patient's vital signs, but we've also checked our patient's blood sugar reading by using a glucometer. And again, if it's less than 60 milligrams per deciliter, we're going to take action to improve our patient's blood sugar reading. We want to make sure that our patient has the 3 criteria in place that are required for the administration of oral glucose. They should have an altered mental status, they must have a history of diabetes, and they must be able to swallow. We're next going to obtain a physician's order, make sure that we have a suction machine available in case this patient does aspirate. We're going to obtain the oral glucose, check the 5 rights, and there's 3 ways that you can administer this medication. Ideally, you simply open up the medication, and if the patient's level of consciousness is high enough that they can cooperate, you have them self-administer the medication to themselves. Okay. Failing that, then we can simply place the medication between the patient's gums, massage it slightly, or you can apply it to a tongue blade, perhaps the lower third of that, place the glucose against the patient's cheek and let it absorb that way, and you can then repeat those doses. During this entire process, we're going to monitor our patient's airway and suction if needed. We're going to reassess our patient's blood sugar reading, perhaps maybe 5 minutes or so after the administration of the oral glucose, and as frequently thereafter as necessary. And we're going to observe our patient closely to make sure that their level of consciousness does in fact improve.